So now let's talk about the patient in the chair. Let's say they have a lot of root exposure. Air polishing on the root surfaces is still contraindicated. If you want it to be even safer when you're using an air polish on those root surfaces, you would use the calcium carbonate air polishing powder. That would be the appropriate polish to use under those circumstances. Hi, I'm Shirley Kutkowski, and I'm here to talk to you about air polishing. A lot of people freak out when they hear about air polishing, especially from a dental hygienist, because they think that there's a lot of problems with it, that there's this with it, and that there's issues with it, and it's messy. Well, here's the thing. There's a learning curve that goes along with air polishing. Right, a learning curve, just like you had when you learned how to use traditional polish. You had to learn how much pressure to put onto the polishing angle. You had to know which kind of a cup to use. You had to know how much speed to use. You had to learn a bunch of different things to make sure that the patient was safe, so that you weren't frying the pulp of the tissue, right? That was part of your learning curve. So there were a lot of things that you had to consider with traditional polishing as you were learning. You had to learn about the speed of the cup. You had to know about the cup itself. You had to know how much pressure to apply. All of those things were to maintain safe stain removal. It's the same kind of thing with air polishing. When you're air polishing, you have to consider the patient. You have to consider whether the patient is healthy. You have to consider the enamel, just like regular polish. You have to also consider what polishing compound you're going to be using in the air polisher, just like you did with your traditional polishing procedures. So it's not much different. It's just a little bit of learning, and if you give yourself a tiny fraction of the amount of time that you needed to learn how to use traditional polish, you're set.